Good afternoon, everyone, and welcome to workshop number 3, Nature on the Front Line. How do we ensure healthy parks, healthy people in the peri-urban Europe? And we've heard quite a few comments this morning referring to the importance of our peri-urban parks, particularly with regards to health. But you know, having that facility of large areas of nature very close to large populations, large urban populations, certainly through the COVID times has become critical, and it's certainly become something that people have valued and become a necessity for them. So our peri-urban parks, of which we're very proud to have inside the EUROPARC Federation, coming previously from Fedinatur, that we're glad to have their input into this workshop along with the members of the Health and Protected Areas Commission of EUROPARC. So I'm not going to say too much more. You see just on the slide there before I move it away, just again the technical issues that we ask you just to be careful of in the Zoom room. I have muted you all just now. I will at some point give you the opportunity to unmute yourself if we take live questions from the floor. But in the meantime, sit back and get ready to participate in the discussions around Healthy Parks, Healthy People Europe. And I'll hand over to the chair of our Health and Protected Areas Commission, Pete Rockcliffe from Scottish Natural Heritage in Scotland, who will chair this workshop. Pete, over to you.
Thanks, Carol, and good afternoon, everyone. Actually, I now work for Nature Scot because
I do apologise.
We've rebranded, but yes, the organisation formerly known as Scottish Natural Heritage, and I'll be drawing on some of that experience, Scottish experience, in the workshop today. But as Carol says, today I'm wearing a different hat. I chair the Health and Protected Areas Commission, which has led the development of the Healthy Parks, Healthy People Europe initiative, which was launched by the Federation in May. This afternoon, though, you definitely get 2 for the price of 1, as this workshop brings together the work of the Peri-Urban Commission, and I'm delighted that we will be hearing from members of both commissions during the course of the next 2 hours. Time is short and there's a lot to get through, so I'll need to be a very strict chair, which doesn't come naturally, so I'm looking to Carol and others to keep me right. We also have a large number of people attending today, which is excellent, and I guess if we're doing a normal EUROPARC workshop face-to-face, having 45 would be difficult, but we're doing it virtually, so it's even more difficult. And we really want a discussion today, so please use the chat function. Keep the chat going during the presentations and the introductions to the various pieces. Not everyone has a hand as well, but also use that if you want to come in during the questions session as well. Okay, so the workshop today is divided into 2 parts. The first part will set the scene with an introduction from a colleague from the Euro Health Network organisation, who I'll introduce in a minute, and myself. We'll then move into a discussion session, followed by conclusions and wrap up. We'll aim to pause somewhere in the middle of all that for 5 minutes. I'm not sure what the theme will be, but obviously it'll have to be something healthy. So it'll probably be getting up and being physically active. Probably in the middle of a discussion session. We'll just see where we are. So with that very brief introduction, I'm going to say most of my introductory comments in the presentation I'm just about to give. So I'll just share my screen with everyone. Okay, hopefully everyone can now see that. There's no time today to look at the evidence base, but I thought it was important to at least start with it. While we should be careful never to oversell the health benefits of nature compared to conventional medical treatments, we know that contact with nature is good medicine and can improve health outcomes for everyone. And this slide summarizes in very simplistic form some of the benefits that we see, both in terms of physical and mental health, lower stress and blood pressure, reduced risk of illness, etc. There's no dosage limit, unlike other prescriptions, health prescriptions. Take at least once, close a day with fresh air. The side effects are generally all positive, And unlike other medicines, we should definitely keep in reach of children and adults. We also know that regular and frequent contact with nature is important too. So nearby nature found in local parks and green spaces are of particular value. And at the same time, we increasingly know that the best health outcomes are those which involve activities which lead to increased understanding and care for nature. The concept of ways to well-being on the right-hand side of this PowerPoint in green, around being active, sharing, learning, connecting and caring for nature should be central to all we do if we are to deliver better outcomes for people and nature in our parks and protected areas. In Scotland, we have developed the link between health and nature through a programme we've called our Natural Health Service, which is a pun on the National Health Service we have in the UK. And at the core of this programme is what we call the 3 pillars, which are illustrated in this diagram. They're in green towards the bottom half of the diagram. On the left-hand side of the first pillar, we have what we call everyday contact with nature. So recreation, pastimes, volunteering, learning, even active travel along green routes, etc. This is where parks and protected areas in peri-urban Europe have traditionally contributed to health outcomes. Some parks and protected areas have also moved into contributing to health outcomes through the other 2 pillars as we move on the right-hand side of the diagram. For first, the middle one around health promotion. So you have a range of activities there around health walks and green gyms and community growing. And you also have treatment programs on the right-hand side, which is at the moment a very small component of what parks and protected areas do, but across Europe we have some practice already in those areas. Now throughout the workshop, and I'm sure amongst the 45 people we have here, different parks and protected areas will have different experiences across those 3 pillars. To be relevant to the health sector though, parks and protected areas need to contribute actively and positively to those 2nd and 3rd pillars, as well as doing the everyday contact. There is some irony, and I was taken by the discussion in this morning's workshop and plenary session around the pandemic and what it means for the visitor management in parks and protected areas. But it's taken almost a communicable disease, which the virus is, to actually highlight, I guess, the real public health crisis, or the underlying health crisis that we have in many parts of Europe around incommunicable diseases linked to physical and mental health. We also know that climate change will add further to this health burden unless we take the steps required to address it, and the associated actions around biodiversity loss. And common to all these issues are growing health inequalities and health outcomes based around physical and cultural barriers to local green space and opportunities to connect with nature. This slide illustrates, I guess, some of the lessons we've been learning during the lockdown across Europe. And this is evidence from Scotland, where we're running national surveys on attitudes and behaviours during this period. And the data looks complicated, and it is, and it suggests quite a polarisation. And while the environmentalists like to emphasise the fact that more people have connected with nature during this period, which is definitely true, there's also a significant amount of people who have haven't been able to access nature during this period. The result is likely to be widening health inequality in health outcomes and other social and economic outcomes too. To address these challenges we face, the call for health in all policies also needs to be matched by a call for biodiversity and climate change in all policies. Healthy Parks, Healthy People seeks to do this in practice, and the next few slides cover its key elements. Our vision is for happier and healthier and more connected people to nature-rich parks and protected areas. And to deliver that, we have 4 pillars or objectives. One around making the case to increase awareness and understanding of nature-based health interventions in parks and protected areas. The second around building partnerships, establishing broad-based platforms at the European, national, regional and local level to bring together health, environment and other sectors to discuss, develop and champion nature-based solutions in policy and practice. The third about developing best practice, building capacity in the parks and protected areas who can deliver this, and developing the evidence base around nature-based health interventions. And finally, and equally important, a fourth pillar around connecting people with nature to improve well-being and grow stronger pro-nature attitudes and behaviours in more people through the use of parks and protected areas for improving public health. We'll be looking at these in more detail. We've framed the discussion around those 4 pillars, so we'll come back to that. And why? I think we've probably heard this in the plenary, in several of the plenary presentations this morning. The programme is about maximising the contribution of health, Europe's parks and protected areas to key policy priorities on health and well-being, but also about protecting, restoring and investing in biodiversity and responding to the climate emergency. And clearly, as we heard this morning also, this is an essential part of the green recovery from COVID-19. There is clearly a lot of good practice that exists across Europe already. And over the last 4 years now, the Commission's been trawling countries to look at the good practice that exists, and the Peri-Urban Commission is doing something similar as well. And here I've listed the elements of good practice that we've identified, which would come together to help you contribute to those 3 pillars. I guess I would naturally focus on the outreach to new audiences, the partnerships with the health sector, the delivery of green exercise programs in partnership with the health sector. But the other sort of bread and butter things that we do as protected area managers, strategic planning, site management, communications, staff training, and critically monitoring and evaluation, which helps build the case, are critical too. So these are the elements of good practice, the how about how we might do this. And the number of outputs from the program, HPHP program, are listed here. We're trying to pull together at the moment all that good practice into a refreshed toolkit and case studies for parks and protected area staff. But we also want to work together to create these platforms that I've talked about. Today we're trying to help build the capacity and understanding for a workshop, but we want to do more of that. And finally, that last bullet is about developing a project. Is there scope here to develop a project where we can test, particularly the 5 ways to well-being approach across parks and protected areas, both to learn and build capacity about it, but also to evaluate and monitor its health impact. I've been talking generally about parks and protected areas generally here, but today's workshop is very much about peri-urban parks and protected areas. And there's a good reason why it's called Nature on the Front Line, because literally parks and protected areas within and close to Scotland's urban areas are literally on the doorstep. They are particularly well placed to support health outcomes for people because of that geography, but also because of the staff that they have and the long experience they have in visitor experience and visitor management. And as I've hinted at already, there's lots of good practice already happening in peri-urban parks and protected areas. Without a shadow of a doubt, there are some real challenges in here. We heard this morning about overuse and behaviours around increased use during lockdown. But there's also challenges in terms of working with the health sector around relevance, around funding for new work, at a time when funding for existing work is challenging. Developing partnerships which work takes time and requires quite a lot of investment of energy and effort. And there are a range of stakeholders here that we don't naturally deal with as well. So that's also a learning curve, real challenges in there. But there are also significant opportunities to demonstrate the benefits of nature for people and ultimately to make the case for investment. I think I've already mentioned the health in all policies. This is an approach which also delivers biodiversity in all policies too. So it's a positive programme from the Federation. Hopefully that sets the scene. Here's a couple of links to further information on the Federation website. Here's the link to the actual programme. You can find more detail about that here. And if you want to be interested in the Scottish experience, there's a link to our Natural Health Service work too. We'll be coming back during the discussion, I hope, and also at the end when I wrap up about the next steps for the work of the programme. But just to leave you with a thought that we really want to engage and involve people, protected area managers who are interested in this agenda in the development of this programme. So one of the key things we'll be doing is hopefully setting up some sort of virtual network to actually share experience and also develop good practice as well. So that's a taste of things to come. I'm going to stop sharing my screen now and hand over to Ingrid, who's a colleague from a sister network. And this is one of the early steps we've taken as a commission, that we want to build a European network, and certainly EuroHealth Health Network are a body which we're really interested in working together on. We've been, for the moment, developing the partnership of a project that we've been talking about. Ingrid's going to talk hopefully about the experience from a health perspective of the current activities that are happening in Europe. Thank you, Ingrid.
Thank you, and thanks so much for inviting me to take part in this workshop. I'm Ingrid Stegman, and I'm program manager at EuroHealthNet, and I'm not sure when I'll start sharing my screen now, maybe. Let's see. I hope you can all see that. This theme of healthy parks and healthy people is really one that's been on my mind a lot. I wasn't at the sessions this morning, but I've heard COVID come up a lot naturally. And although I live in Brussels, in the last 5 months, I was in France at my father-in-law's house, who has a garden and lots of green space beyond that. And although, as with many of us, it was quite stressful to work and have kids around at the same time to telework, at the same time, it was also really for me an opportunity to reconnect with nature and to watch the seasons pass. And at some point when I was outside, I was listening to a podcast where they were referring to nature. Whoops, I feel like I'm gone. Can you start video? Sorry about that. There's something wrong with this camera. Apologies for this.
Don't worry, Ingrid, just carry on. We're fine.
Yeah, I'm not the technical expert, so everything was fine. Sorry about that. But in any case, it helped me reconnect with nature, but I heard someone saying that green is the new gold, and in this situation, it so resonated. But I was also, through my work and our work here at EuroHealthNet, so acutely aware of the fact that very few people have this luxury nowadays of green at their doorstep that can appreciate the benefits and have the benefits of that. And it was also, I was very aware that the reason I was there is the fact that we are in the process of destroying this natural asset of ours. So nature is beneficial, and it's even crucial to our health and well-being, as Peter has so well laid out. And we've been exploring this in the context of our work at EuroHealthNet, and in particular in a project that we were involved in, or that we coordinated, called Inherit, that looked very much at what can be done to encourage and enable more people to engage and reconnect with nature and to benefit from its value. Just to say a little bit, to give you a bit more context about the work that we do, EuroHealthNet is a not-for-profit partnership of organizations and agencies that are working in the area of public health, disease prevention and promotion, and on reducing health inequalities. So the focus of our work is very much on, is not so much on healthcare, but what we can do to keep people out of healthcare systems. And our members include public health bodies. And as part of this work, we coordinated the project Inherit that I just mentioned, which brought together 18 partners from across Europe and looked at what can be done to improve health, the environment, and health equity simultaneously. And this is what we refer to as the triple win. And we explored what can be done to multiply and scale initiatives that can generate triple wins. So just to unpick this, from a health perspective, as you know, environmental degradation is probably the biggest threat that we all face to health and well-being. So it's critical that we all focus on this. But also many of the factors that are driving environmental degradation, as we know, are also those that are really threatening health and leading to health inequalities right now. So lack of nature and green space is, for example, very much associated with sedentary behavior, which we all know is bad for our health. So it's easy to find these examples like green space of double wins, but where does the triple come in? Well, when we do implement double wins, so often the benefits of that are for those who are already well off and not so much, and then they don't reach those who are already less well off. So it's really important to identify what can be done to ensure equitable conditions for good health, and to focus on the aspect of reaching also the more vulnerable populations. So that again is what Inherit focused on. And it was really about thinking which policies and interventions can encourage and enable people to adopt behaviors that can lead to a triple win, in order, like eating less meat or engaging more with green space, that can lead to greater demand for this and create more positive feedback loops that can generate overall better environmental states and better health for everyone. So in this respect, we amongst other things, investigated my screen. And this is again, we identified a number of triple win policies in different areas, and studied this in more depth to see what can encourage uptake of these initiatives, and also to look at their impacts across multiple dimensions and the triple win dimensions, and also to investigate where we could, and to the extent we could, the cost benefit of these interventions. And I'd like to share with you 3 examples. And the first you can see here, it's the Malvik Path in Norway. And the Malvik Path is a 3-kilometer path along the coast that was created from a disused railway. And I have to admit, when I first heard about creating green space in Norway, I was a bit perplexed, because Norway is full of green space. But it's, of course, about the fact that this is unused space. It was abandoned space, so it's not really benefiting the health of anyone. So it did make sense. And this particular pathway was designed to connect 2 residential areas. And there's, and to connect, as you can see, blue and green areas. And there's, for example, a bench area and seating halfway between this path, which is 3 kilometers long. And an important feature of the creation was the fact that population groups were included in this, in its implementation, the community members. And it's also free to use, and can and a real effort was made to make it as accessible as possible, so that it can be used by people in wheelchairs and families and prams. Since the opening of the park, the researchers have found that the highest levels of frequent users were in fact people from low-income groups. Children, older people, and people with mental disabilities really were those also amongst those that benefited most. And it's not used, as you can see, just for exercise. It's used for a very wide range of activities. When people were asked about why they used the path, it was really about their accessibility and availability, and the quality of the path. And these were much more influential factors than, for example, factors associated with individual users, like age or even ethnicity. And an economic evaluation of the Malbec path reflected that that the investments of creating the path in this is highly beneficial from both a societal perspective, and that it was profitable in all scenarios after the first year, or that it was profitable immediately, almost, the net value. So this is a really nice example of how an abandoned area, in this case it was a railway, was recovered and transformed into accessible green space and could be beneficial for health, social inclusion, and physical activity. So a second example that was also from the Netherlands was in the city of Breda, where a strip of what can be seen as dead green land that was connecting two neighborhoods was restructured into an attractive park. And the neighborhoods in this area had high levels of ethnic minorities and low-income groups. And before the restructuring, this space wasn't used at all, and so it didn't really provide health benefits, and maybe it provided, except for maybe adverse health, it was adverse to health because it was considered unsafe and threatening to many people. And so they actually avoided using it. And a key feature, as you can see from the slides, of the restructuring was the fact that it put a huge emphasis on participation and involving the community in the design of the park, and different members, different social groups in the community, older people as well as children, and really designed it on the basis of their ideas. So as you can see, what the children wanted it was a play area, but activities, there was a slide, they made it more topologically, more geographically interested, and created a slide and a water play area and a clock, because the children wanted to know, to be able to see what time it was and what time they had to go home, so that was added. And older people wanted gardens and benches to sit, obviously, and watch. So a garden was added that is managed and maintained by some of the older residents in the communities. So it really brought together the different desires from within the community. And the intensive efforts that were put into involving the community really paid off, because it's now used much more frequently and has improved the social cohesion in the community. And the third and last example that we looked at in Inherit was Thinking Fadura. And this is area in Spain, in northern Spain, in a town called Gexto, that was previously part of a private sports club. So it was only open to private use. And so the municipality decided to open part of it, or open it fully up to public use. Some parts were gradually opened, but as you can see, there wasn't a consistent, it wasn't consistently open, so it was fragmented. So it really helped to create a further green space corridor. And so that in total it added 20 hectares of green space to this town. And here too, the community really, or the municipality really worked with residents and a wide range of other sectors to design the park. And an important feature is that a workshop, for example, was organized, bringing together a very wide range of stakeholders from the public and private sector, but also across different sectors like the environment sector and from businesses, to discuss the different kinds of impacts that opening the park could have. And it was interesting to see what people perceived as the possible impacts, and for them to hear this from each other, to also get their different perspectives. So generally, and the residents, local residents, were also surveyed about what they perceived the impacts could be. And most saw the most positive impacts as being the fact that it improved physical activity, that it would probably reduce car use and promote active travel. But they also mentioned a number of the negative impacts that it could do, such as, and we're worried about that, such as the threat of the risk of more vandalism in the community, bodegas, or that more youth would come in for drinking parties together, and also that it increased risk for social conflict and violence. And it's very important, these impacts were taken into account in the cost-benefit analysis, but also it's important to also for the municipality to know what the residents perceive and to play into that, to design and then monitor what's then happening in the park in order to make the community members feel engaged in the park. It's also interesting that at the time when the research into the use of the park revealed that that a lot of the green spaces themselves weren't actually being used, but that people most used the corridors, so the path, and used it as a corridor. And it could be that because could be that when the park was monitored, it wasn't fully finished, so it was difficult to reach some of the green spaces, and there wasn't really foliage around it, no trees around those green spaces. And also they hadn't yet put outdoor gyms or benches in these places that would attract and engage youth. And so they did expect that use would increase over time as the park was being finished. I should say that all of these studies took place in the course of a year, so they're quite limited. The scale was quite limited in terms of to be able to really assess the impacts. But nevertheless, the economic evaluations and the cost benefit of the evaluations did reveal that, that for every euro that was spent, the benefits were, the social and economic benefits were estimated to be about €6. And that the park would be profitable after 15 years, which is apparently the average for parks like this. So just to recap, investing in nature is really a win-win-win. And it's about investing in the environment, health, and societies in society. Nature really is about or a public health tool for us. More green spaces can lead to more active lifestyles, provide access for disadvantaged people in parks, lead to less noise pollution, and it's a cheap and easy way to really build social capital and build health in cities and increase resilience. But for people to see the value of nature and to experience these benefits, they have to be able to come in contact with it. And this isn't easy for most people, and people, particularly those with fewer resources. And once they do, they are more likely to exhibit more pro-environmental behavior, which is also why it's so essential to engage children and make parks and green spaces attractive to children from very early on, so that they take this behavior on across their lives. It's also important to provide amenities and facilities, though, that make it easy for people to go and engage with green space. And for this, the parks need to include features that enable people to want to go and use them to walk and run or cycle or play or just relax and enjoy social interactions. And to ensure this, it's really important to, as we've seen from these examples, really engage the residents and community members, not only in the planning and design of the process, but also in thinking through the potential impacts, which can be both positive and negative, that should be addressed. And then not to stop there, but to follow through and to keep engaging with users of the park and keep the users, existing users of the park engaged, and also to just identify what can be done to attract new ones by, for example, well, perhaps organizing events that they might like in the park, like aerobics classes or exhibitions or music events. And what ideally the aim should also be to work towards a type of co-ownership of the park, that people are engaged to the extent that they want to invest, and taking this to even further. There are quite a few models that we didn't look at and inherit, but that I've heard of, that community residents, the different sectors, co-invest in different ways in the maintenance of the park. And for example, organize a society that maintains and co-manage a society that maintains the different parks. So that's at the more extreme end of co-ownership, actual co-ownership. And this, of course, everything that I'm talking about is very much about collaborative cross-sectoral working. It's not just for the managers of the park, it's for different sectors to get engaged, because and to realize the benefits of that engagement to them. I've listed the word social prescribing, even though, again, the Inherit studies didn't look at this, but obviously for the health sector, this is an important entry point and way to get engaged, as Peter has also indicated in his presentation. It's a very powerful tool to get people and then socially vulnerable people to engage in parks and to understand and experience the benefits that it can generate for them. When I mentioned cost benefits, and it's not really the area I'm familiar with, it's quite, but I think it's interesting that it was mentioned throughout cost benefit analysis that it's quite, there were some areas, things that could be quantified and many things that couldn't be quantified. So it's important to be careful when we're looking at cost benefit analysis, because it's so hard to see what really these have taken into account, and if they really reflect social value and what we truly in our society's values. So it's an important area to look at, to see collectively how we are making the case, how we can strengthen the case for investing in more triple win activities. Again, I recently heard the example of the Amazon, where if you talk about cost benefit analysis, what's happening if you cut down the Amazon is insane in terms of the services that the Amazon provides to broader ecosystems, but for the people directly involved, it's they're doing it because it makes sense to them, but it would make much more sense in terms of the value placed on that, and I'm sure similar just green spaces in Europe too, that we relook at what really is the real value and how we're looking at that nowadays. So maybe we should even pay to preserve, people involved to be preserving green space in terms of the values, the return that it gives us.
Thanks, Ingrid. I'm going to have to...
just my final point is that, so that's just to conclude, I think that the COVID pandemic has really been disruptive, and if we look at the signs of behavior change, that's really when change can happen, and that we are, and the EU level and all of us are really open to looking at these things and seeing how we can to looking and invest in the value of green space in the context of our lives. Thank you.
Thank you, Ingrid. Sorry to rush you at the end there. We did hear quite a lot this morning from the EU Commission about the new biodiversity strategy and the links that it makes between health and well-being and nature, particularly in peri-urban world. So you've provided some resources there. That was a really helpful introduction. I guess my observation from that, and it's probably hopefully reflected by participants, that a lot of the interventions are, I would say, bread and butter interventions for many peri-urban and protected area managers. I guess the two things which stand out, which are possibly different though, are the I guess the economic case that you've been building around those interventions, and in there you bring in the sort of health economics and the benefits from reducing health interventions, and also the inequalities angle, and using tools such as health impact assessment and dialogue and discussions with the health sector really help there. I'm already squeezed for time, and we've had two really useful questions, I think. One around health impacts from being by yourself and in nature compared to being in groups. And one about behaviours and acceptable behaviours between city parks and national parks. Can we just pause those two questions, and I think we'll go into the discussion session and come back to them. Also, both the questions are quite complex, and I suspect will require quite a bit of discussion. So if we don't answer them in the next hour, we'll definitely come back to colleagues who've added them in. So without further do, I'm going to ask Nelly to introduce the first of the 4 pillars we talked about in the programme about making the case. So this next section will go through each of the four pillars one by one. We will then, there'll be a short introduction from a member of the Health or Peri-Urban Commission, and we'll have some discussion hopefully. So keep going with the chat. And also keep reflecting on Ingrid's presentation in particular, and the sort of what we could be doing different that emerges from that presentation. Okay,
Ingrid, can I just ask you to stop sharing your screen, please?
Thank you, Carol. So Nelly's camera is not working, so you will see a blank screen for the next few moments as Nelly introduces the subject.
Yeah, hi. Estonia is an e-country, but seems to fail in it. So I'm sorry that my camera is not working. I tried to fix it on Friday, but even IT people didn't fix it. So let's start with the first pillar. If we are talking about health and protected areas, as Pete already said, we have 2 important documents in EUROPARC. One of them is the toolkit, and another one is Healthy Parks, Healthy People Europe program, in abbreviated version HP. And they are all interlinked. But what is the purpose of the toolkit is that it provides practical advice for you as a park, and also on a country level how to set up policies. But it also provides you with different resources in evidence, such as reports or surveys, and it also shares examples from across Europe. And this means that if you would like to promote health and well-being benefits in your protected area, then at first you should read through the toolkit and see where you are at. You can do the checklist to know if you are delivering a health promoting park or protected area. And then this toolkit and checklist helps you to think about how to plan or manage or promote your site so that it improves people's health and well-being. But also it shows you examples of how to connect this topic with health sector. But still, we are looking for case studies more and more. Please share them with us, with our Commission or EUROPARC, and especially in the challenging times, we need to find new, innovative, out-of-box solutions to get inspired. So if you know somebody who knows somebody, please share your examples and case studies. In the toolkit, there are several messages, and I will just highlight some of them. The most important thing is to understand that nature is a health promoting asset. And this is one of the key messages. There is evidence that nature can promote your mental and physical health. It can treat or manage your diseases like depression, heart disease, diabetes, dementia, etc. And the toolkit helps with evidence on why we should consider health and nature hand in hand. If we understand the benefits collectively, then it's easier to communicate the linkage between health and nature. And this year, we celebrated the European Day of Parks with the theme Parks for Health. In Estonia, it was also linked with health. I understand that in many countries, European Day of Parks was virtual, but we were allowed to go out in small gatherings, and more than 500 people participated, 60 events in 35 protected areas. And this was all organized by tourism entrepreneurs. Usually we do these kind of events by protected areas authorities, but now the main organizers were tourism entrepreneurs. And it was a superb example of good cooperation between Protected Areas Authority, Visitor Management Authority, entrepreneurs, National Tourism Board. And all this was done in very difficult times, how to plan a meeting or event with strict rules. But this is our new normality. Another key message in the toolkit is, as it was already mentioned, that green at our doorstep. It means that our national parks and protected areas are well placed. People who live close to the protected area or visit them, it's very close by all of these sustainable tourism destinations. And here are some numbers, for example, that these destinations, we have 60 million people living in or within 1 hour of these destinations, and over 74 million people visit those destinations. So as more and more people are living close to the cities, we have a big number of target groups in the peri-urban parks or peri-urban areas. And even in Estonia, where there are very scattered people living in the cities, they use more and more nature facilities provided either in the city parks or close to the city. And another key message in the toolkit is, of course, again, the good examples. We need case studies, and especially now in the changed world, in order to learn from each other. During the COVID times, in the springtime, in Estonia, people went outside more than ever, but not knowing perhaps what are the benefits between nature and health. Just that they didn't want to be inside. So we now have them outside, but we also need to address them correctly by speaking the same language, showing the evidence, showing concrete examples of the benefits. So in other words, making the case.
Thank you, Nelly.
Yeah.
Thank you. I'll just stop you there if I may. We're not flooded with chat questions at this point around making the case. So rather than move on, is there anyone who wanting to make an intervention around the evidence base and whether we have marshaled the evidence base? I think Freya had a question around, I guess one of the studies she's come across is around people gain health benefits in terms of being by themselves in protected areas, and I guess there's also quite a lot of health evidence around its associability of being in nature with families and with other people, which also produces health benefits. So there's quite a mixed message around health benefits in there, and I guess one of the things the Commission has tried to do is try and synthesize some of that. But I'm just a general question if anyone wants to come in around the evidence base. And going back to Ingrid's presentation, whether Ingrid, you had a comment about the economic analysis that had been done and whether more of that approach would influence, I guess, policymakers, particularly in health and local authorities who we work with. So 2 questions in there. Does anyone want to come in and talk? At this point, Carol, I have to say I can't see any hands, but I don't have a hand function. No.
Yeah,
Ingrid.
I'm just looking.
No. Well, I think there's a huge amount of evidence out there about the health benefits. It's for the policymakers and for people to experience. It's hard. I'm not sure if people read about it, and versus so to what extent evidence goes so far in influencing policy, but it's also really the experience often of policymakers themselves, and that comes and culminates and then drives. That's why we really did focus on this. How do we give the impetus to actual action rather than just the benefits and the cost benefits? Having said that, I think the cost benefit analysis and economic analysis is hugely important. again, it's not my area of expertise, except to know that it's hugely confusing, and it is a question of what is being measured when we're talking about those benefits. So I think it always helps, as I just did in a presentation, to say they are cost efficient, and it's profitable. And I haven't been able to dive into it. I know I'm not quite sure what it means, and exactly, you know, it covers so much a cost benefit analysis, what is really being costed. And so do politicians know that too? Some economists with an economic background, maybe yes, they just think, oh, it's good. Mm-hmm. Is it? So that's a bit what I was trying to tease out, but how can we clarify what it means in relation to people's values? And that's very complex especially as we're talking in the situation that we are now, where we are maybe becoming a bit clearer on values, and health is first and foremost, and how is that being taken into account, and is it being sufficiently, the impacts on social engagement and health inequalities, and how can you integrate that, and what are the costs being held against that as or things that are considered costs versus benefits. One example is just housing, as I'm sure many of you know and are more even familiar with than I, that it's a contentious area. It's considered a benefit, but is it really in health inequalities terms when people are priced out or can't rent in areas that become more attractive? So, and that's considered a benefit, an economic benefit. So that's where I think it is worth looking at and trying to make this more accessible, what are costs and what are benefits, to make the case.
Thank you. I think I would summarize that by, you talked there about qualitative evidence, you talked about social and economic evidence, and you also talked about values in there as well, which I think that's the sort of picture that is required to change decision makers and influence budgets, etc. I think Paolo had his hand up. Do you still want to speak, Paolo?
Hello, everyone. Thank you. The fact healthy parks, healthy people, and peri-urban is something that I have viewed in a recent e-conference or e-meeting with South America. Was very interesting in the sense that they are as worried as we are, they are as surprised as we are for the fact that we are now having or gaining a visibility as a kind of public health infrastructure, like an hospital, shall we say. And if a protected area is an hospital, in the sense that it's a space where you go to get better, to get something, to get fixed. The ranger would be our medical staff, in the sense that the people that work in the protected area would be the persons that would be habilitated, or some tourism service over there would be able to handle this new service that we can provide, or at least that we are being asked to provide, or at least that everyone, this rush that no one asked them to come, and suddenly we were claiming for not having people, and then suddenly we have so many people, comes to, you have the protected area as an hospital, you have the ranger as a medical staff, and you need proceedings, you need protocols, health protocols. You go for a specific hospital to get well for a specific disease, or to other places, My concern, or what was interesting in the discussion with South America, is that this new role that is being asked to, is clearly being asked to protected areas from the outside, would clearly need, like you were saying, instruments that could measure, or at least from the outside of the protected areas world, meaning from the health sector, would be very helpful to establish clear assessments that would be able to clearly state that we as a protected area, as a public health infrastructure would be helpful. And from that, in that sense, in that meeting, and that's why I want to make the linking and ask also Ingrid, was the branch of America of the World Health Organization was developing an assessment, an instrument to access the benefits of going to public areas. And the thing is, would it be interesting to try to bridge this and to have similar procedures working with the similar instruments in order to evaluate what are the benefits of going to protected areas and be recognized worldwide when at this moment we have a unique visibility of World Health Organization. So if they can support us on this, or if they can provide a good tool to evaluate our role, maybe we can also profit in that. At least a win-win situation, if possible, a triple win, when I introduce in that case the local stakeholders as winners also. Thank you very much.
Thank you, Paolo. That's really interesting. We've talked about whether we could develop that sort of assessment tool as part of the project, or at least experiment with doing it, because I wouldn't underestimate the difficulties in bringing that together quickly. And I guess the other experience we've had around, there's the assessment approach, but there's also the sort of logic modeling approach, where if you have enough evidence, you can decide what the right things are, and then you can follow. If you do the right things, you'll produce the result that you're after, even if you don't measure that result. So I guess there's various approaches that both commissions, I think, would be interested in. So we'll certainly follow up the IUCN angle with you as well. I don't know whether Ingrid wanted to come in on that.
I think it's just to say that I don't think it should be expected of people working in parks and doing their jobs when demand increases and people recognize the health benefits, that they become the health specialists within that park. I think it's the role for the health specialists to come in and realize that this is a role that really does advance their objectives, and what can they do indeed to play that role. So I think your role is to do what you're doing and keep doing it well, to get people in those parks and to keep them coming in. And when there's more demand, it's also for the role of the municipalities and public sector and private sector to see, okay, there's demand for this out there, and how can we get people to co-invest, and so that it's not on the shoulders of those that are there now, which is probably the current situation, absolutely, but it's mobilizing. Indeed, it's the change in values and change in what we value and what we're willing to pay for, and how is what we collectively need to work on to get those triple wins. That positive feedback loop working.
I think that's a really important point, Ingrid, that we're not talking about us becoming health experts, but we need enough familiarity with the language and the sector to be able to support health outcomes. But our unique selling point is nature and connecting people with nature. And on that point, I'm going to bring in Nele, I'm going to bring in Lisbeth, who's going to talk now about what was the fourth pillar, but I've changed the order slightly to talk about the connecting people with nature and nature for all approaches. Lisbeth, I hope you're still there.
Yes, hi. Hello, everybody. Hi. I will talk to you about connecting people and nature, because most of you already benefit from and care for nature, but some people still face barriers in connecting with it. And therefore, we want to promote a Nature for All approach that was launched by IUCN and is founded on the knowledge that the more people experience nature, the more they appreciate, love, and care for it. Moreover, this approach can improve public health and help reduce health inequalities. Now, to reach out to new audiences, we need to take away existing barriers. These can be, for example, fear and perceptions. So we need to create safe outdoor opportunities so that family groups can get together in public parks Schools should have secure nature-based play areas. And we can also implement programs to help people and gain more confidence in nature. Then there can be a lack of resources, which can limit the ability for an individual to get to a place, to enter it, or to participate in an activity. To overcome these barriers, we need to look at the transport, accessibility, maybe a discounted admission for certain target groups, or a system of borrowing, recreating equipment, and so on. Next to that, there is a worldwide trend to enhance the opportunities for people living in urban areas to experience nearby nature. Creating and supporting parks, green schoolyards, community gardens, or wildlife corridors are all examples of actions that facilitate opportunities to connect with peri-urban nature in a meaningful way. But what is connecting in a meaningful way? So therefore, we like to introduce you the 5 ways of making that connection, the 5 ways of well-being in nature. First one is be active. Go for a walk or a cycle through green space, explore, discover, find your favorite places. 2, connect with new people, share experiences, talk, listen, connect with the natural environments and the wildlife that surround us. 3, take notice, be curious, look at the beauty in nature, notice the changing seasons, use your senses, whether it's the view, the bird song, the warm sun, or the smell of the forest. 4, give, smile, show others the joy of engaging in nature. Take care of the places you like. Take up volunteering opportunities. And 5, keep learning. Try something new, rediscover an old interest, sign up for a course, try rock climbing, photography, or bushcraft, and so on. These are all meaningful ways to connect with nature, and you will find more info on these 5 ways to well-being in our program brochure or the upcoming guidance. But now I have a question to you, and that is, how do you identify audiences that you are not reaching yet? And what do you do to engage them? Thank you.
Thank you, Elizabeth. That was really good. So anyone want to come back with any experience they had about an audience that they've reached out to that was new to peri-urban park or protected areas? Or has anyone got a comment about the, I guess, for connecting people with nature? We've talked there about the positive sides. I think we've had a few comments on the chat about the negative sides, about poor behavior, bad behavior, irresponsible behavior as well. So I guess there's that balance between the 2 roles that comes into focus there. So anyone want to share some experience around hard to reach or difficult to reach or unusual audiences that people have been working with? Does anyone want to come in? I don't see any hands again. I think Carol and I have been chatting offline and saying this is a hard to reach audience itself, but it is post-lunch and you have been on Zoom quite a lot today. Again, a question for the Commission. Is there an experience you draw on in terms of examples of hard to reach audiences? I guess the thing that's been in our minds quite a lot has been the example of in Cumbernauld in Scotland and the work that SWT and TCV volunteers have done with with groups suffering from poor mental health. They've been taking them out into their local woods, into their local reserves, and getting them to experience and connect with nature and each other, and following that route that the five ways that Elizabeth was talking about, and that's had a real impact, which is measurable on their health outcomes and their well-being as individuals as well. So very tangible signs of success there.
Pete, there's a raised hand.
Okay, I can't see it. Would you like to come in?
Okay, hello everybody. Do you hear me?
Yes, thanks, Nico.
Okay, I have a new headset, so I have had some difficulties with my voice, but it's great the technicalities have been solved. So we have been working with, let's say, I think you could call them difficult to reach target groups in northern Finland. Our partner is the city of Oulu. We have partners who are working with, I think social rehabilitation is the correct term here. So we are working with youth that have different challenges in personal life, in social life. So it's a lot about health inequalities and how to overcome those. And like some of you might know, the traditional ways of public social rehabilitation is about utilizing, let's say, all kind of workshops, indoor activities, of course, expert facilitated indoor activities. But what we have offered and pilot tested is really outdoor activities and even nature restoration activities. We are a practical level organization working with protected areas, so it's easy to understand that national parks and Natura 2000 network, there are really many different kind of options that we can test and see what really works, what doesn't work with the youth and young adults. And the best experiences that we have had so far are really those nature restoration activities. For example, traditional meadow restoration, stream restoration, basically anything where people get really hands dirty and have some physical challenge and get to work together. And what we in future, what we would like to learn more is really the impact and the the more scientific evidence base on how effective this cooperation in reality is. But our empirical, let's say, evidence is that it's very promising, and there is more demand than we can actually offer. And as a next step, we would like to start organizing a larger partnership within Finland, find new stakeholders, new partners with whom we can more elaborate the model of cooperation, have new, let's say, working and pilot environments that we can use and find more experience on how this cooperation works. And from the perspective of protected area management, our challenge is actually on balancing on how much our conservation biologists can really provide time for those new groups and how much they should purely focus on their main work, that is nature conservation. So that's a really key issue for us at the moment. Our mandate in health promotion is not very clear.
You are stinking.
Thank you, Vico. That's a really lovely case study. And you've issued, I guess, for the challenge there around capacity, and we're just about to move on to that topic. But can I just ask you a question about the benefits in terms of your protected areas in that northern part of Finland? Do you see tangible benefits from the investment you've made in this work?
Well, I think the very concrete feedback we have gained from the participants is the most tangible benefit. Their willingness to continue working with us and hear more about the work that we do for nature conservation. So that is something that is very, very tangible and obvious. I mean, the demand for more of this kind of cooperation. As well, the experts who work every day with the young adults, they are highly motivated because this is a totally new way of operating for them. So they very clearly see the potential that is connected with this way of working in nature. As I said, we need more evidence and more professional evidence.
Thanks, Vico. I think we also need to tell that story about the benefits in terms of people's values and opening up new areas of collaboration for parks and protected areas too. That's almost to me as important as the evidence base that we have about what works and why it works. I'm going to move on. There's some interesting, I think Vico's asked for experience around, I guess, engagement with young people in, I guess we'd call it conservation volunteering or restoration work. And there's a chat going on there. So keep sharing the chat on that. Vico's also raised the interesting challenge about capacity and also skill set, I guess. A lot of us are trained in environmental or ecological sciences. That's quite a different skill set to some of the, I guess, the outreach work that is implied in some of this activity. So I'm going to ask Nikos just to introduce the third topic around building capacity and skills within our sector. Nikos.
Okay, you hear me?
Yes, thank you.
Okay, thank you very much for the invitation, Carol and Pete, and for this avatar floor too. Nice to see you all in these small screens. We don't need advices and guidance for nature. We need more green areas in the cities. We must gain every square meter to transform it in a green space for having the conditions for a healthy life. So we are very lucky because many researches are completed till today with very severe results and conclusions about the relation between the health, the human health, and the nature. We have the tools, we have the knowledge, but we search, I mean the peri-urbans, we search for more green space in the cities. This is the crucial, and I'm very happy because the HPHPE toolkit is intended, it says, to provide simple and practical advice on how park and protected areas can support health outcomes for people. Our toolkit, the toolkit from Peri-Urban Commission, is more practical, not so, let's say, theoretical. We have work to provide practical tools on planning, design, and management measures to host different kinds of users and promote the biodiversity in urban green spaces. So I fully agree with the idea of Paulo Castro for the capacity building which is needed from the staff who works in the protected areas in peri-urban parks and protected parks. I think that this is crucial because the attitudes and the habits of the people has changed, but the identity of the green is the same. And so we must adapt to this pressure of the people, and in all range of staff, from the managers to the guards, to the staff which is every day in the field. So I have stole some key points from an international conference which hosted last year in Athens about the forests and public health. In this conference, researchers had many good results from the research, and I can, let's say in bullets, I can say some key points. The research says that the beauty, the scenery, the wildlife, sensory and seasonal experiences, sense of freedom and atmosphere of the park sites were key drivers for participants and greatly enhanced their experience of being active in nature. Okay, we know that, but the research confirms it. The quality of natural scenery increase this thing, the restoration outcome. Of course, the specialists make measurements on this, but this is very thin, the limit between the huge forest and the some shrubs. They find differences. The managers must follow these results. The other great topic, the parents and children who participate in nature education programs improve, of course, their nature attitude, the communication skills and family strength. We know that, but we must enhance it. In addition, children's self-efficacy improved through task solving and accomplishment through participation in nature experience activities. The children must be active in nature, not protected, not feel free, but be free outdoors. And of course, many nature pedagogical activities stimulate the senses and can provide suggestions and assistance for the implementation of nature as a therapeutic space. Okay, you know that in the Far East, mostly in Japan and Korea, in Taiwan, they work very strong in the forest bathing, in the therapeutic aspect of forest and nature, but here in Europe, we use nature, just use nature for such as the aims, for feel healthy, for be healthy. Okay, for all above, we must have a framework for capacity building, which covers all the range from managers, from the pedagogues, the guards, the technical staff. We must gain a common language on this, and that is crucial for the collaboration between the two commissions, the Peri-Urban Commission and the Healthy Commission, and must exchange experience between all countries and all protected areas, because there are deep differences between northern Finland and southern Greece. For example, we have problems to solve about the thermal comfort of the people during summer in a green area. I can imagine you have such problems. I think that all these are very well known to all of us. And a suggestion could be to enhance this collaboration and organize seminars, webinars, even study visits in different places to have a larger view on all these topics. Thank you very much, Pete.
Thank you, Nikos. That was excellent. I'm going to move on very quickly because we're running out of time, as predicted. I guess the other bit of, I guess, the offer, and I'd be interested in thoughts about this, is developing a network of members around this issue so we can share good practice and exchange information on a more regular basis. So interested in comments around that on the chat as we go forward. Is there anyone who has a question at this stage? I can't see any hands. So I'm going to go on to the fourth pillar. We're making Carlos work very hard today. You've heard him speak this morning. And Carlos is just going to speak briefly about building partnerships with the health sector.
Thanks, Pete. Good afternoon, everybody. I promise this is the fourth and last pillar. The program just has 4 pillars. This is about building partnerships, and as Peter already pointed out before, the objectives are around to establish platforms at different levels, from European, national, and regional, to bring together health, environment, and other sectors that can be involved, like social sectors, etc., and to develop and to push for champions and nature-based solutions in policy and practice. And this should be done mainly through 2 different actions at 2 different scales and levels. So the first one is to establish a platform of health and protected areas experts at European level, so around HP Europe. We are really happy to have Ingrid from EuroHealth here today, because this is the level, the scale of strategic that we are talking about. And the other one is from EUROPARC, to support the partnerships that are being developed at different scales, from national to regional to local level in this field. So we have examples, as Pete showed before. The Scottish level is really very interesting. That the scheme he showed of partnership among health and environment sector in Scotland. We can find similar strategic agreements in Finland or in England. And in our case, we have some regional schemes in Catalonia of collaboration. The video I show you, I shared the link in the chat, is about that. And if somebody is interested, we have some experience as well in establishing local partnerships at municipal level, mainly in peri-urban small towns and municipalities in the area of Barcelona, with examples of how to work together, environment and health sectors, both private and public. So I will be happy to share with you. In the case especially of peri-urban parks, as we already said, so there are strategic areas already with strong pressures and impacts because of the strategic situation. And probably the main question is that new proposals linked to benefits on health and people well-being can be an opportunity, but at the same time, if these opportunities are not really well planned and managed, can be a challenge before these areas, peri-urban areas, are already very, very stressed by a really huge number of visitors. So probably the challenges and the questions then that we can share during this half an hour of debate we have is that are peri-urban areas, peri-urban parks prepared to assume this role in public health and well-being? We have seen during this COVID and post-COVID month that the number of visitors really increased, and probably will go on increasing. So these areas are prepared. Can be established this partnership of health sector and environment sector in these peri-urban parks. This can be advantages. For instance, if we move to more light activities linked to well-being and health, this can reduce the pressure from other uses and activities, very intense and very impacting, like the ones we have related to extreme sport, for instance, or extreme activities, and we can move to other activities more linked to walk, to relax. Just that can be this an opportunity. And for instance, another question would be, with this background, what specific partnerships, what conditions we need to do this in peri-urban parks, considered as a very special areas compared to other natural parks. So I will give here, Pete. Thank you.
Thank you, Carlos. Some questions in there. No one has come instantly back on chat, but are there any comments that people want to make at this stage? I appreciate I haven't given you a 5-minute break yet. during the course of today. So we're going to move into a sort of Mentimeter period in a moment, but I'm just going to ask if there's any more questions that we haven't quite picked up around partnerships and capacity building. Ingrid, you want to come in?
It's just a comment as I'm listening that that links to both partnerships and capacity building, maybe more partnerships, but it's really about, it's one thing to work together, it's another to act together and really get more green space out there and benefit more people. So it's the question around in all partnerships, and then new partnerships building, who's willing to pay and who pays what. And I think that's such a contentious and important area. And again, it's people, public, private partnerships. And apparently there are some good models out there. I just know New York, Green Park, Central Park, where people are coming together to these sectors to pay together. And that might give impetus to faster action in a time when resources are so scarce. But how much are citizens willing to pay? How much is the health sector willing to invest without being, how much of this is really health sector benefit? How much, and I think that's, it's only a comment because it's such a contentious area, but it's so key to partnerships and capacity, because we need, it's a new area and we do need also capacity in that, in terms of understanding each other's work, how it's structured, and how then they can merge to get those collective outcomes much more. So restructuring how we all work is part of it.
Yeah. We're back to triple wins require a policy and integrated funding framework, which isn't quite there. You're dead right to bring the question of funding back onto the table, because it's ultimately drives a lot of the work that we do. I mean, certainly in Scotland, there are examples now of us drawing funding from the health sector budget into improving green space and into things like health walks and green gym activities. So there are lessons, but I think the more we can share that sort of practice across partners, the easier it is to sort of win the case for doing it elsewhere. We're very jealous of experience in certainly from the section in Spain, EUROPARC Federation section in Spain, about working with health insurance companies to actually provide a bit of money for the work that the section does around promoting protected areas there. And I'm sure there'll be other experience across the network, but being able to bring that experience together, I think, is a really helpful asset for people starting those discussions or heavily engaged in those discussions, because it shows what's possible. And there's nothing like a bit of competition between countries and between regions to get things moving as well. I'm just reading the chat while I've got here about examples from Flanders, which are excellent. I hope everyone is seeing those, and we'll certainly want to follow that up with Miriam as well around your experience there. If no one, I don't want necessarily to close on funding, partly because we're going to just do a couple of Mentimeter questions now. So this is your chance, if you haven't said anything, to actually influence what we're going to be doing as the pair of commissions we have here today. So I'm going to hand over to Jolie just to run through the two questions. This will take hopefully less than 10 minutes, Jolie, but we shall see how effective we are in using Mentimeter as a workshop group. Thank you all for that discussion session. Jolie.
Okay, thank you, Pete, and greetings from Lapland, Rovaniemi as well. I'm Joel Ekkonen from Parks and Wildlife Finland, and I'm going to run a few Mentimeter questions for this workshop. So let's start with some instructions. First, I want you to open a new page from your internet browser, or take your mobile phone or tablet at hand, and then go to Mentimeter, menti.com, and enter the code 95873 366. And by the way, you can see that they code on the screen all the time. And then you have a few questions, and I would like you to read the questions carefully and the options before you submit your answers. And Pete, could you tell me if you see the screen properly?
Yes, I can see the screen. The questions are clearly there.
Fine. And the first question is, what topics of the Healthy Parks, Healthy People Europe program should especially develop to support peri-urban parks and protected areas in delivering better health outcomes? And please note that you have 100 points to use for different options, and use those 100 points wisely. And finally, press submit. And we can see the results on the screen.
Aha. Perhaps we made the mistake, Jolie, of putting building health partnerships is coming up first. That's great. Just to answer Miriam's question that she sent me on chat, you don't need an account for Mentimeter, but if you just open up the Mentimeter page on your browser, it'll ask you for the code that's in the top of the screen there. So you should just be able to enter the code and click in.
And
Nelly says it's just like a Menti.com.
Yeah.
Thank you. How many people have voted, Jolie? Do we know if
19.
we got nearly everyone? 19.
19, 20.
19 or 20. Is anyone wanting to vote who hasn't voted? Okay. Ooh, a late rush for monitoring and evaluation of health outcomes just snuck up the table there. Okay. I mean, this is always dependent on the people in the workshop, of course, but it's interesting that the sort of, I guess the work around building the relationship around health outcomes, building activity on health outcomes, and building a relationship with health sector. I guess the pillars 2 and 3 that I referred to earlier are the things that come out in this discussion. And I guess the more bread and butter stuff that parks and peri-urban places are involved in, it comes out more towards the bottom, which is quite interesting. Jolie, do you want to move on to the next question?
Okay. And the next question is an open-ended question, and it goes like this: what is the key action that you will take away from this workshop to help develop the contribution of peri-urban parks and protected areas to the health agenda? So let's view our open-ended actions for a minute.
There's some really interesting actions being put on screen here. Thank you for all this. This is really good stuff, and covers such a wide range of actions as well, which is itself really good, if a bit challenging perhaps for the commissions. And how many have we now got, Jolie? Have we nearly got everyone, do you think?
24.
24. Okay, just a couple more minutes if you're still thinking. Translate that into typing, please. Okay. Thank you, Jolie. That's really good. I guess the observation here, and obviously I want to take away, and we'll want to take this away and look at it, is these are all questions of how rather than why. And I guess that's, I think if we were here a few years ago, there would have been more why questions rather than how. So I think that shows the development of this area of work for protected areas in the last few years. It's all very positive, but about doing things with the health sector, with other protected areas, with different groups and outreach and connecting more people with nature. But quite rightly, there are still a few questions about capacity and training of staff, and also the balance between nature and people in here, which is ultimately, I guess, what the challenge of being a protected area manager is in peri-urban Europe, but also in Europe full stop. So I think there's some really interesting things for us to reflect on here as the two commissions. I guess the other thing I would take away is this thing about talking more between ourselves, and that's not for its own sake, but actually just to we can write and we can present, but actually in the discussions that we have as colleagues and as part of a network, the Federation network, we can inform and provide insight as well. So there's something there about the live, how we develop capacity through face-to-face or virtual face-to-face in future as well, which I think is really powerful. Thank you for all that, and thank you for your chat and comments and discussion today. I've got the last, I'm going to give a final word, or the near final word, to my fellow chair of the Peri-Urban Commission, Maria. So Maria's just going to come back and hopefully summarize what we've been hearing today in a few closing observations. So Maria, if I could just ask you to take the floor.
But Pete, sorry, shall I stop sharing the screen or can I leave it?
Are people still writing? Do you know?
Not anymore. 29.
No, let's just have Maria on screen, I think.
Sorry?
If you come off and close the poll,
okay.
And then Maria can come on, that would be excellent. Maria.
Okay, thank you. Well, Pete, time is almost over. I think every important concept has been told, and there is a lot of things to add. Only that I have the sensation that the claim for nature everywhere, but especially in cities, it's coming, and it will become a tsunami. Because after the experience of COVID-19, then the reaction of people is to rediscover nature and to rediscover that we have a necessity of nature. Then it is mandatory to undertake this challenge. On the 2030 European Biodiversity Strategy, state in the introduction that the recent COVID-19 pandemic makes the need to protect and restore nature all the more urgent. Then I think according with the conceptions of our commission, Peri-Urban commissions, we consider from time ago that cities should have protected natural and rural spaces, and that these should be considered essential strategic elements of the territorial model and the concept of the city, to have to overpass the concept of urban areas and countryside. No, it's the same. Yes, agriculture is part of the city also, and nature is part of the city. Then we always have said that peri-urban parks represent the direct commitment of the cities to the protection of ecosystems and preservation of biodiversity. Then you have been working in the Health Commission to promote, to give knowledge and highlight the concept of health coming from the nature. Yes. And then I think that we are in Health Commission and the two sides of the same coin. We are obliged to work together from now on, of course. You realized this last year in Latvia. You participate in our workshop also. But on doubly, when the nature Healthy Park, Healthy Nature takes the broadest dimension is peri-urban parks, because as we have stated, every one of us, the proximity of these ecosystems to the people. Then the problem is how to involve citizens, and in addition to the administrations, in the fight for better protection of biodiversity and ecosystems to guarantee a high level of health for the population. This is a big challenge. I think if we this morning has been told that if we have the the public opinion with us, we can win the battle or the war. And then Peruvian Commission we are obliged to move a step forward from the highlight concepts of biodiversity, urban sustainable development, sustainability, to the health also, because is an element that we have told about, but we don't have highlight enough. Because it's not only biodiversity that is at risk, it's also our health that it is at stake. And we have to have commitments with our generation and the next generations. Then to summarize in a sentence, a simple sentence, the more protected areas we have, the more health we provide to citizens. Then the more health we need to provide, the more natural areas we must protect. Then, okay, we help each other, and this is a win-win action, and I think is an evidence. In the end, with a broader and holistic vision, we are also calling for healthy cities, not parks, cities as a whole and planet as a whole, but cities. That the first step to have healthy cities is to have healthy parks, of course. And well, to say that the continuity of human life on the planet depends on the preservation of natural ecosystems, and the higher quality of nature that surround us, the better level of health we can achieve. Then we have heavy work to do. Then we have to take the engagement to describe what activities, health activities have been fit in our parks, in Peruvian parks. And we have to develop this element, because it was as I mentioned, it wasn't the list, but it was at the end of the list. Then I ask for your help and to progress together and to push and to make lobby for administration at all level, local, regional, national and European, to recognize the necessity and to, at the end, to have the clear idea at the end to obtain funds. But these funds is a part of the health policy. One part of the money dedicated to the hospital maybe could be dedicated to the nature parks and protected areas. Well, is my resume and my summary.
Thank you, and thanks for putting the context of, I guess, peri-urban parks and protected areas in that bigger context of the urban ecosystem, both human and natural, which I think is something we could have spent a whole workshop talking about too, because that relationship is really important. And I guess the other expression I take from that is about joining up. We still have to make the case and work with particularly local authority partners here in delivering this agenda. I am nearly out of time, so I'm afraid that's going to be it from the workshop today. I'm sorry we didn't quite get into the discussions that perhaps some of you wanted to, and although we've had a lot of chat discussion, we haven't had the opportunity in this format to take it forward. We will be looking at the chat and also getting in touch with the workshop attendees and others who've expressed an interest, not least in setting up a network. So watch this space, and you should be receiving some communication from us. If you want to get in touch with us, Maria or myself, we're always welcome. If you're interested in the work of the Commission, do let us know. We are always looking for keen and new members, not necessarily young members, of course, but that's always good too. And just to say, final sort of advert, in November there's another webinar where we'll be wanting to talk in a bit more detail, I think, about the project. that we've mooted about. And if there's certain things I've taken away from today, just to close, one is about this sort of health assessment, a process, logic model assessment that we talked about, particularly around making the case, and then the monitoring and evaluation work. I think I've probably given the last word to that speaker.
No, it'll be me.
So on that note, I'll hand back to, do I hand back to Carol at this point?
You do. Yeah,
Thank
thanks.
you.
Well, everyone, thanks very much. That was a bit of a marathon this afternoon. Thanks, Pete, for chairing the session, Ingrid, for your interventions, Yuel, Nelly, Lisbeth, Carlos, and Nikos for your considerations, and Maria for your conclusions at the end, and obviously for everyone else for your patience and forbearance in doing a lot of listening. And I'm sure you're all desperate to know what the theme of the pause is. You've been wondering what I'm going to come up with, I'm sure. So we will be moving into another short 15-minute pause, a little bit of a longer pause. And of course, there's only one thing that it could be, and that would be the 5 ways to well-being pause. We will be the only workshop that will be able to have that pause. I can't say what the others will do. So I suggest to you, if you remember the 5 ways of well-being, that in the next 15 minutes that you take 3 minutes to be active. I strongly suggest that you get up out your chair and run around your room for 3 minutes. 3 minutes to connect. 198 people have already downloaded the mobile phone app. You could add to those number by connecting in 3 minutes. 3 minutes. Use your senses. And for me, if there's actually, I want to close down my senses for 3 minutes, and I could do with 3 minutes of silence. So I recommend that to you too. 3 minutes to give. Lisbeth gave us some suggestions about how we could give, but I think maybe what we need to do is give ourselves a break and just have 3 minutes to ourselves. And then 5 minutes to just reflect on the learning that you've already taken, that's already taken place today. So in 15 minutes, you can have your 5 ways of well-being. And as usual, the little slides will come up to remind you of the different things that you could take part in. And I will have loads of exciting announcements in the session following, telling you all about tomorrow, and of course what's going to be happening tonight in our social evening for those of you who can join us. So please stay for the session next. You will have to leave this session and rejoin another one, but I leave you with those 15 minutes and I will set up the pause. I have to share my screen, so I shall do that now. But thank you very much for being with us this afternoon, and we'll see you in a few minutes on the other side, in the next session.